Welcome to Section 6 of our IV therapy training, IV cannulation and administration technique. In this session, we'll walk through the process of selecting the optimal IV site, inserting the catheter, initiating the infusion, and monitoring for potential complications. The first step in successful IV therapy is site selection. Here are the key considerations. 1. Forearm versus hand veins. The forearm often provides larger, more stable veins, reducing the risk of dislodgement. The back of the hand can be used for shorter or lower flow infusions, but may be more painful or prone to movement. 2. Gauge considerations. Select a catheter gauge appropriate for the therapy. 18 gauge for rapid infusions or blood products, 20 or 22 gauge for most routine infusions, 24 gauge for pediatric patients or very fragile veins. 3. Ultrasound guidance for difficult veins. In patients with poor vein visibility or those who require long-term therapy, ultrasound-guided IV placement can improve success rates and reduce complications. Now let's go through the steps for cannulation. 1. Apply tourniquet, palpate vein, disinfect area. Place the tourniquet 4 to 6 inches above the insertion site to engorge the vein. Palpate the vein for a firm, bouncy feel. Use proper skin antisepsis chlorhexidine or alcohol swabs, allowing it to dry completely. 2. Insert catheter. Observe flashback. Advance catheter. Remove needle. Hold the catheter at a low angle, about 10 to 15 degrees, and insert into the vein until you see a flashback of blood. Advance the catheter off the needle into the vein. Release the tourniquet and remove the needle safely, engaging any safety mechanism if present. 3. Secure catheter with appropriate dressing. Use a sterile, transparent dressing or specific securement device to protect the site from contamination. Label the site with date, time, and gauge of the catheter for reference. In this clip, watch how the clinician identifies a suitable vein, inserts the catheter at the correct angle, and secures it to maintain sterility and prevent dislodgement. Once the catheter is secured, we're ready to connect and initiate the infusion. 1. Prime IV tubing to remove air. Open the packaging carefully and spike the IV bag. Let fluid run through the tubing, ensuring no air bubbles remain. 2. Connect tubing and start infusion at ordered rate. Attach the primed tubing to the catheter hub, ensuring a secure, needleless connection. If using a gravity drip, calculate and adjust the flow rate by counting drops per minute. If using an IV pump, program the rate in milliliter per hour as per the physician's order. 3. Observe for infiltration or reactions. For the first few minutes, watch the site closely for swelling, pain, or leakage. If you notice anything unusual, stop the infusion immediately and assess the site. Finally, monitoring is crucial to ensure patient safety. 1. Check vital signs regularly. Observe changes in blood pressure, heart rate, and respiratory rate that might indicate fluid overload or an emerging allergic reaction. 2. Assess IV site for phlebitis, infiltration, or extravasation. Phlebitis signs: redness, warmth, or palpable cord along the vein. Infiltration or extravasation: swelling, coolness, pain. Catching these issues early prevents more severe complications. 3. Watch for signs of fluid overload or allergic reaction. Fluid overload: sudden shortness of breath, elevated blood pressure, crackles upon lung auscultation. Allergic reaction: rash, itching, difficulty breathing, hypotension. At any sign of adverse reactions, stop the infusion and follow your emergency protocol. That concludes our demonstration of IV cannulation and administration technique. In the next section, we'll address infusion safety and complications, where you'll learn about potential adverse events and how to respond swiftly to protect patient well-being.